I work in 800 Grand Concourse, and there my population is primarily Latin American, although the population is changing. Now I'm experiencing a lot of Central and South Americans, which the Latino culture is the same across the board. We may think that we're different, but we're not that different. There's more similarity than differences. Primarily in the South Bronx, patients come from the Dominican Republic, Puerto Rico, Cuba, the islands, Jamaica, West Indies, and the level of education is not that high, although it may vary. There's some people who are highly educated, but you need to understand that you're dealing with a population that has very limited access to health. Not because it's not there, because it is there, but they don't know how to get it. And that's one of the difficulties that we experience in the healthcare system in the United States, is that we deal with populations that don't know how to access health. And given the fact that we come from cultures that have different beliefs about health, and we're not that readily able to trust the medical system, we tend to have remedies or to go and buy things that a friend or a family member say, oh no, that is this disease, you need this. And then it complicates the picture when they come to us. And that's one of the things that I try to let them know. Do not take anything. Let the disease manifest itself, because I can recognize it. But if you have taken antibiotics and things are masked of an infection, I won't be able to recognize it. Or the course of the disease will be longer and the patient will require hospitalization. My work consists on delivering services that are culturally and linguistically appropriate, taking into account that the patients that I serve are primarily poor, from poor countries with poor literature skills, not English speakers, and that limit their ability to understand the system and to get a good services for them. They have different approach to health, and sometimes physicians believe that the patient don't want to take the medication, and that's not the case. The case may be that they have a new person in the house, and that person is consuming the energy of this elder patient, and they not taking the medication. The reason may be varied. They may be depressed. They may have economical difficulties. Now the money that was going to health is going to something else. And we as physicians need to understand that there are variables that need to be kept in mind. It's not just take this, go home. We need to tell them what the side effects of the medication is. We need to tell them that they need to eat appropriately. We need to tell them that they need to exercise, that they need to use less salt, that they do not need to drink sodas, that they don't need to drink juices because that's just loaded with sugar. And they don't know that. And unless we tell them, we're not gonna know. And there's some things that they will not tell you is what you don't ask. If you ask them, they will tell you. If you don't ask, they will never tell you. They will not volunteer that information and tell you, no. The reason I'm not taking my medication is because my granddaughter moved in the house. And now I'm expending all the money on her care. So they're not gonna tell you that. because they may not know where to go and what to do or who to talk to. It's important to understand that factors that affect health are mental health, socioeconomic status, and socioeconomic factors that have a direct impact on the patient's health. It's important to understand also that not everybody who comes into this country knows how the healthcare system runs.